Good afternoon, everyone. We have here today Dr. Morita Ayako from the Tokyo Medical and Dental University. Thank you for joining us, Dr. Morita.
Hi, Julian. It's nice
Yes.
meeting you.
Yes, so we're very interested in your research area and your field of study because it's very diverse, but at the same time, it's very important to our society. So what actually inspired you to address the topic of global health and social medicine and early childhood settings and how it affects later life health?
Oh, well, I specialize in the public health, especially in the social medicines. And yes, as you said, like my research target is like older adults mostly. Um, it's I read this book called La Shomon.
Mm-hmm.
It's a very famous Japanese literature and also become a movie. And my teacher in a junior high school spent a week or more reading the first line. It's
Wow.
about the man. It's about a man who lost a job and don't know what to do and standing in the rain. And then he found the old woman who is a robbery, who takes up everything from the dead bodies. And he was first like a struggle. He had this moral conflict. And finally at the end he overcame this moral conflict, or he didn't care anymore, and he actually robs the older woman. But the first lines, it's just saying like a man is standing in a rain or something. And the teacher asked like, why do you think the author started a story in a rainy day? Why do you think this man lost a job? Why do you think he asked so many questions? And then I become interested in studying a human's mind and how, like, what changes our mind. In a story, the man rapidly changes his mind. So I found that there is a discipline called psychology. And I went to undergraduate in Canada to study psychologists. Because I heard that after undergraduate, if I get a PhD, I will be able to even like prescribe the medicines like a psychiatrist. So, and then I volunteer for the mental health institutions in a weekend, and then while studying a psychologist, and then I saw the same people be hospitalized and dehospitalized. And they also know that even after the hospitalization, they have a high chance of coming back again. And one day I saw that group of the patients discussing what to do, how to live in a community. So I become interested in preventions, like building the community to, prevent them from developing mental health, or at least like prevent them from coming back to the hospital rather than treat. Yeah. And then it's a long story. So you can.
No, it's very interesting. I mean, preventive health is very important now, and of course, we would rather want to be proactive than to be reactive, right? In like you just mentioned, we treat them today, they might come back soon. So it's very important to start a lifestyle that actually emphasizes on prevention of diseases.
Yes, thank you for summarizing.
No, all right. Especially in J societies like in Singapore or Japan.
Yes, there's a lot of stigma, I think, for the mental health. So and I came back to Japan and then worked for a public health center. That time I was like administrative because I only had like undergraduate degrees. And then, but I kept wondering, like, why this program is run? Like, is this program effective? Like, why are we doing this? I had a lot of questions rather
Of
than like
course.
carrying out all the program.
That makes a good researcher, right? Is to be curious and to ask yourself a lot of questions to
Yeah,
debate. Yeah.
yeah. I was asked by many people, like, why did you pursue the career? Like, why did you choose a career as
Yes.
a
Yes,
scientist?
we want to know as well.
Yeah, my answer was always because I didn't know
Mm,
things. I felt that I want to know, I need to know about this world. So,
sure.
and then like the head of the public health center, which was a female
Mm,
doctor, she saw me kind of finishing all the job early, but like I think she saw me not being satisfied with my work.
sure.
So
Okay.
she invited me to her office and she said, after the work, you can spend as much time as you want in my room. You can read any of the books in my bookshelves.
Oh, wow.
And
That is
yeah,
really
so
interesting and awesome.
it was she linked me with the graduate schools really, like, because then I read a lot of academic papers, and then I found the professor who is studying about social epidemiology, and
Mm,
I contacted and I applied for the
oh,
graduate schools. I found a scholarship and everything, so I was ready to uh,
yes.
go to the graduate school. And
Absolutely. So the emphasis on it and also the takeaway is that of course you need to have the passion to learn and the passion for the field. But it sounds like it's also very important to have someone there to guide you to serve as your role model. So to the other women and girls and even men out there, what advice do you have in terms of being proactive also in searching for a mentor? Or seeking help, because we all need help at some stage, whether in our personal life or our professional life. And I think a lot of us are a bit afraid to ask for support. What advice do you have or insights to share in that aspect?
yeah, I agree that role model is very important, and um, in my generation, the most females were housewives. We are brought up by the mother, whose
Mm,
occupation is a mother, and then the fathers who works 6 days a week. It's only a recent that Saturday and Sunday become a holiday for us.
yes.
It used to be that, yeah, we work from Monday to Saturday, and then common that, how to say, male is a breadwinner and women is a child taker. So um, when I think of like a role models,
Mm,
it's the older generations, like who has been a professional women.
mm,
Many of them don't have a family. I
mm,
have my family now. I have children.
mm.
So um, how they work may not exactly match to like how like my
Sure.
current
Mm,
environment. Um, and I would look for. I'm not sure whether I call it a role model, but how to say, learning partners
mm,
from my
mm,
generations. I
mm.
have many. Uh, when I how to say, I have many colleagues who
Yes.
are females who
Mm.
also who are married, who have children, who
And
have other needs to take
mm,
care of
yeah,
while they
they play different roles, all
they
at the
play.
same time. Mm,
Yeah, but also a scientist.
mm.
And then we exchange like information not only about our work, but we talk about how are you managing,
Mm.
what do you do when you
Yeah, how do
have
you
a
juggle all
conference?
this and still make it work?
Yeah, still make it work, like or just like observations.
Mm.
I just came back from the conference, but I see some a female scientist, they brought the small children's
Mm.
like to the conference places, and then like maybe during the presentation they how to say, ask the babysitters to look after. But then afterwards, maybe they take them for, walk.
Sure.
Yeah. We try to learn from each other, like what can we do? Yeah.
Absolutely.
Because I think how to say, maybe like role models of the successes.
So you learn from one another, you share your experience and knowledge, and also in doing so, you actually form a support network for yourself and for your peers. So to show that you're not alone in this, but like you're in it together.
Yeah, like innovative network.
Yes, and also not afraid to be vulnerable and actually voice out your problems, the issues that you face, and things like that. So no, that's awesome, and I think that applies to not just women or mothers, but particularly so, but also to us men. We tend to, I think, the pride is a very it's a good and bad thing, and it sometimes prevent people from asking for help or voicing out their problems. Now then, you have established yourself very well, and also as a leader at the university. Now, so what are the factors or experiences or support system that you find very helpful for you to thrive in this environment? Because STEM can be very stressful, and also it can be quite competitive as well.
I'm quite lucky because Tokyo Medical Dental University has a strong support for the female scientists. Not everybody, but if you how to say, accumulate a certain career, with how to say, articles and
publications,
and then if you're selected as like selected, you receive a special support, like for example, when you can have let's hire a research assistant for yourself, who can do like for example, preparation of the questionnaire, printing out, sending all the like administrative but like important research work. You could ask the assistant to help you. That's because one of the challenges that scientists with small children face is the time limit.
Of course.
Even when you have a nursery to look after your children, you have to pick them up at
sometimes there's always the time that you need to watch out for. Yes,
and also on the day you cannot just leave the house, but you have to bring the kids to the nursery, which could take a lot of time if your child said like, today I don't want to ride on a bicycle, but I want to walk.
Yes, absolutely. So then, because I mean, of course, it's particularly challenging, and not just the time, but also the energy and we all get a bit disheartened sometimes, and so especially again in research, we hit a wall or we get discouraged. Now, then, what advice would you have for aspiring women and girls to be part of STEM? Because research is not easy, as we know it. Medicine research is not easy. It's an arduous journey. It takes a lot of patience and perseverance. Now, what advice can you share with the audience out there who wants to be a part of STEM?
So the girls who are already interested in the science,
yes, or who are actually thinking of being part of STEM, what advice do you have for them?
Well, I think it depends on the discipline, right? But I think it's one of the advantage of the student is like you can contact anyone. I mean, when you become a professional scientist, maybe you have to take a steps. You cannot just like I mean, not everybody, but like you have to find the time to introduce yourself and then create a networking.
Yes.
But if you're a student, you can just
It's
write
more
an email.
casual and
Yeah,
spontaneous.
write an email
Yeah.
like, "Hi, I read your paper," and you become interested. Like that's what I did. Yeah, I read
No,
your
that's
paper
good advice. Yeah.
and become interested in. Yeah, and then so don't be shy and then you ask them like, so what should I do next? I'm interested in this. And then if you want to, maybe the person said like, okay, if you want to work for university, then you need to have a PhD, yeah, in many disciplines. But if you decide to work for like a company, maybe a master degrees, maybe okay, and then maybe it depends on the discipline. Maybe you'll be asked to have a I'll say, professional experience outside the university first.
Absolutely.
Like a public health, many doctors work in a clinical level first, and then come after. So
yes. No, that is very, very important advice, because especially the part about don't be shy and to actually make use of the spontaneity and the freedom that you have to approach people and do not be afraid to ask questions. Now, to round up this session, what do you think going forward, in terms of your research area? What are some of the important things that people should look out for and not neglect, especially because social medicine is important in many aspects. So what are some of the things that we need to pay attention to? And of course, the first thing that comes to my mind will be mental health. And I think it suits the theme of what we are talking about here today, is to form a support system, a network, and to be encouraging to women and girls in STEM. So then, what are some of the areas that you would like the world to look out for to in this regard?
I think during these few days, due to the COVID-19 pandemics, like individual disciplines, health behaviors has been emphasized a lot. And sometimes like people who get COVID-19 who are infected, some people are blamed, like, oh, that's because you are not wearing the mask properly, or you went to this places. Yeah, individual blame is very common. But I think in my disciplines, we emphasize a lot about the impact of the environment beyond the individual's efforts. We need to learn how our life, how we behave, how we think, what we do is shaped by the environment, and then try to find like the modifiable factor. Maybe like genes, something like a gene, like what you're born with, may not be able to change easily. But for example, like a network, what we just mentioned, having a supportive network among the female scientists, contacting the leaders in a profession you're interested in.
Yes,
that's something that we can change. And once we know what we need, I think we should voice out.
Yes.
To bring up the change at the macro level.
To advocate on bring on a change and to make things better.
Yes.
Yes. Well, on that very positive note, thank you very much, Dr. Morita. It has been very illuminating to hear how the aspect of social medicine and mental health comes into play to become a successful researcher and clinician. So thank you again very much for your time. We look forward to hearing more of your insights again on similar topics and, of course, of your work soon.
Thank you very much, Julian.